Good morning, students. Today we will see about an interesting topic, the limbic system. Yes, before that, on a lighter note, have you all watched this movie? Yes, I can hear a few of you shouting, Inside Out. It's a beautiful animated movie in which all the emotions in a human being, in this movie, it's a small girl, how they interplay among themselves. So the first one, running happily, is joy, followed by this is fear, and this little man in red is anger, this girl in green is disgust, the last blue, always in blues, is sadness. Similarly, our body also has a lot of emotions and feelings, and the important system that deals with these emotions and feelings is the limbic system. The term limbic lobe or limbic system refers to a collection of four brain structures that consist of both gray and white matter around the hilus of the cerebral hemisphere and a group of associated deep structures. The word limbic has originated because of the arrangement of various structures in a ring-like manner. Can you see this? Yes. So that is the reason it is called the limbic system. So this is a ring-like fashion, all the various nuclei are arranged. This is a simplified diagram in your textbook. Okay, so this is the ring form. The limbic system consists of the limbic cortex and the subcortical nuclei. The limbic cortex has cingulate gyrus, orbitofrontal cortex, subcallosal gyrus, parahippocampal gyrus, uncus, entorhinal cortex, pre-piriform cortex, olfactory lobe, and subcortical structures namely amygdaloid complex, hippocampus, hypothalamic nuclei, anterior thalamic nuclei, septal nuclei, caudate nucleus, para-olfactory area. Now, the important connections in the limbic system, first is the fornix. This is the main projection of the hippocampus, uncus, and the amygdala to the mammillary body. Next, important circuit. Okay, we'll be dealing about this circuit in detail in memory also, learning and memory. Okay, so that is your Pepys circuit. So this Pepys circuit is responsible for memory as well as emotions of a human being. Can you see here? The four important connections of Pepys circuit are the cingulate gyrus, the hippocampus, the mammillary bodies, and the anterior thalamic nuclei. So this connection together form the Pepys circuit. However, the hippocampus and cingulate gyrus are connected to the brainstem, autonomic centers, and the reticular formation. We'll see about it. The mechanism of action. First, the limbic system receives both the internal stimuli as well as external stimuli. From there, the stimulus is transmitted to either the reticular formations or the hypothalamus and the pituitary. The reticular formation in turn sends it to the somatic nervous system. The hypothalamus stimulates the autonomic nervous system, and the pituitary through the hormones bring about the effects. So this is the main mechanism of action of the limbic system. It brings about the effects through autonomic, somatic, and the hormonal systems. So coming to the functions of the limbic system, very important function is emotions. That's the reason I displayed all different emotions in the first slide itself. The second is behavior. How well behaved we are or how aggressive we are depends upon the limbic system. Learning and memory. So limbic system also plays an important role because of the Pepys circuit in learning and memory. So emotions, there are two components of emotions. One is physical emotions and one is mental component of emotions. We know, yes, in movies, in many cinemas, they will show all different facial expressions for emotions: anger, joy, fear, surprise, depressed, sadness. So similarly, there are two components, one being the physical component and the other being the mental component. Mental components are mainly cognition, that is, awareness of sensations and their cause. So when you're watching a thriller movie or a horror movie, at 12 o'clock in the night with your cousins or your siblings. Okay? So if someone just sneaks through, you'll be always, your sensations will be fully alert. Okay, not like in the classes when you're half asleep. Yes or no? So it is like we are aware of the sensations and their cause. What they're going to cause also we know. The affect is the feelings, how we are going to express it out. And the conation is the urge to take action. So when suppose we already saw in sympathetic system, the fight and flight. When a snake comes, you either fight with the snake or you flight away from the snake. So this conation is the urge to take action, to do something. Okay? So these all are the mental components. When you see a snake, yes, that's your emotional response. Yes. You will not say, hi snake, how are you? No. Yes, so that emotional fear is experienced in the brain and it is expressed either somatic or visceral response. You get shivery, you get jittery, you start sweating, that fear component. Next coming to is the physical components. Physical components can be visceral changes like a rise in blood pressure, tachycardia, sweating, tachypnea. All these are your visceral changes. Or there can be somatic changes like you start shouting, crying, grinding your teeth and bouncing. Okay, so when you don't study, okay, and it's time for Viva, how is your response? You're very nervous, isn't it? You start biting your nails, fingernails. Yes, and when it's your turn to Viva, how do you look? Oh my God. Yes, so that is your response, mental response. Coming to the role of limbic system in emotions. The amygdala and the emotions. Input connections being the visual centers, auditory centers. So sometimes horror movies, the sound of it only will make you jitter and get away from your seats. Next will be output connections, namely the hypothalamus. Activation leads to self-stimulation behavior, a range of emotions. So any emotions depending on the stimulus. And finally, it assigns emotional significance to the events. So when I was in childhood, I had watched that time thriller horror movie was Evil Dead. So even now, when I think of the movie, it brings a chills under my spine. Yes, so that gives the emotional significance to the events. So I told you these are all the emotions: joy, anger, disgust, fear, sadness. Yes, but which one are we having more? Yes, anger. There is a phrase that whichever emotion you feed more, that grows more. So it's better to not feed the anger emotion inside our brains. Yes or no? Yes. Coming to effect of lesion of amygdala. So this amygdala, when it is destroyed, so I already told you amygdala is very important for the rage, that is the angerness, the emotions in a person. Suppose this amygdala gets destroyed, it causes placidity in the individual. So destruction of amygdala in monkeys produces placidity. An angry, very violent monkey, once the amygdala is destroyed, it's also a therapeutic way, for certain uncontrolled range of people having uncontrolled anger. So they do this destruction of amygdala. Many of your mothers will be wishing for this, because you people shout sometimes at parents. Yes. So when the amygdala is destroyed, it produces placidity. The animal becomes very soft, it doesn't shout, it becomes very calm. Bilateral amygdaloid lesions are tried in patients to control aggressive mental behavior. Yes, of course, yes. It is done in human beings. When you go to psychiatric posting, you will be reading a lot about this. So when there is a very aggressive, uncontrolled behavior, in such cases, in such patients, bilateral amygdaloid lesions are tried. Coming to behavior, there are two types. One is instinctual behavior. That is, it can be your sexual feelings, your feeding feelings, and the maternal feeling. The second is the motivational behavior, social. Okay? Your friends can motivate you, your teachers can motivate you. Protective. So you can be more protective, like for the family, you will think of it and you get motivated, reward or punishment. So now here, note things. I have told two things. One is reward or punishment. Either you give a person some reward and encourage them in doing a particular process which you want, or you punish them and stop them from doing a particular thing you do not want. So there is a reward center and there is a punishment center. The role of limbic system in behavior. So first we will see the food intake. Limbic system is responsible for discriminative feeding. That is, there is a center in which it's called satiety center. The ventromedial nucleus inhibits a lot of food intake, whereas the lateral nucleus stimulates food intake. So that is your hunger center, whereas the ventromedial is your satiety center. When you eat some food, okay, the abdomen stretches, the stomach wall stretches, the impulses goes and gets relayed to the ventromedial center, nucleus, and it says, enough, bus, stop, enough. You have had good amount of food. Okay, so that is your satiety center. Adanalada, they will say, chew your food, eat it slowly so that you don't overeat. Whereas the lateral nucleus, it stimulates. Whenever you're hungry, the lateral nucleus is stimulated and it will say, yes, come on, it's time for food. Yes, go eat some food. Yes. And the neocortex also facilitates in food intake. The limbic lobe is usually responsible for this discriminative feeding. But what happens when there is a lesion in the amygdala? It produces hyperphagia with indiscriminate ingestion of all kinds of food. So lesion in amygdala causes hyperphagia with indiscriminate ingestion of all kinds of food. Anything they will start eating. That is, even if it is not edible, they will start eating. You know, such patients usually we see in psychiatric wards where they eat hair, they eat soil, they eat stones. So that is called indiscriminative ingestion of all kinds of foods. Okay, and this is favorite Garfield. Yes, so that satiety center is lost. They keep on eating. Yes, yes. Coming to the role of limbic system in behavior. So sexual behavior. The limbic system has an important role in sexual behavior. The basic sex drive, that is, the urge to copulate, is a complex phenomenon involving the coordinated efforts of both the neural as well as the hormonal mechanisms. And this is like, there's nothing bad to discuss about it in a class, in a medical class. It is just a very essential for any species preservation. So perpetuation of species, this urge to copulate is very mandatory and it's very basic. It's very common in animals when we've seen it. So this urge has to be preserved. The piriform cortex and the amygdala in male, that is a limbic lobe, appears to have a role in sexual activity. This limbic system is concerned with species preservation through sexual behavior. Suppose there is any lesion of the piriform cortex, that is increase in sexual activity in the presence of testosterone. So there is a lot of hypersexuality noticed in male animals. Then there is other behaviors also I told you, that is your maternal behavior. Limbic system has an important role in facilitating maternal behavior, that rooming in about the bond between the child and the mother. So there are a lot of jokes telling that the Indian mother, yes, this dialogue. Yes, so that bond between a mother and a child is mainly because of the limbic system. So that affection, yes, all of us, any problem, anything, the first person at all stages of life, which we have gone and we will be going, is our mother. So this maternal behavior is brought about by the limbic system. Yes, how beautiful this is, yes. The monkey. The mother is always careful that the child should not fall down. Yes. So any lesions of the cingulate gyrus and the retrosplenial portions of the limbic cortex depresses this maternal behavior. Prolactin. You all know that, no? During breastfeeding, prolactin is secreted, and this facilitates this behavior, directly acting on the brain. And oxytocin also facilitates maternal behavior. That is the reason we say after the delivery, as soon as the child is delivered, It should be breastfed within half an hour. So what happens? That bonding comes once the child sucks the breast milk. For the breast milk, the oxytocin is released, prolactin is secreted, and all this influences the maternal behavior. Motivational behavior, as I already told you, reward and punishment centers. When there is a reward for a particular behavior, it is continued. So we are encouraged, yes, come on, let's do it. But if instead punishment is given, then one stops doing that work. And you say, don't do this, and just give to wax, then the child doesn't do it that often. I can't say anymore, but that often. Okay, so that is your reward, punishment centers. In limbic system, the septal nuclei is your reward area, and the entorhinal cortex is your punishment area. The role in memory is Pepys circuit. I already spoke about this. It's your cingulate gyrus, your hippocampus, your mammillary bodies, and your anterior thalamic nucleus. So hippocampus, they are areas for consolidation of memory, and Pepys circuit is this process. In detail, we will see the Pepys circuit in playing a role in emotions. So what happens? This is your mammillary bodies. So this is your mammillothalamic tract. From there, impulses go to the anterior thalamic nuclear group, cortex of the cingulate gyrus, the para-hippocampal gyrus. Certain informations are stored in the neocortex as well. Okay, so they are processed and stored there, so that in future you will know when this happens, this is the emotion. So that is the reason you can synchronize, or you can retrospectively analyze with that situation. Empathy is there. When a person suffers from sadness, we also feel it. Okay, so that is all because of these connections. And the hippocampus and back to the fornix, to the mammillary bodies. Coming to the anatomical changes in the hippocampus, can you see this is an 87-year-old person's CT, whereas this is a 27-year-old person's scan. The location of these scans in the brain. So at this level, the function, development of learning and memory, changes that is noticed are reduction in the size due to the cell nodes in the structures. So gradually as we become old, the potential that the brain has at a younger age to learn and store it and recollect it, the memory is gradually reduced. Another solrong, yes, yes. Other functions, olfaction, connections of olfactory pathway to limbic system, that is the amygdala and piriform cortex, mediates the emotional, motivational, behavioral, and physiological effects of smell sensation. So, we always, my favorites like, yes, the hot steaming biryani. So, okay, smelling it only will bring us all the emotions that is related to it. Okay, there's one more I had recently brewed. Kajal Agarwal will come smelling that, Amma, then it will be like her husband has prepared the same coffee using the same powder. So it just connects us emotionally. Okay, so this olfaction and limbic system plays a very important role. Autonomic functions. Limbic stimulation produces autonomic effects, particularly in blood pressure and respiration. So it's very important, high blood pressure and respiration. So the autonomic functions related to the limbic system. Next is the stress. This word, my God, used everywhere. The amygdala produces responses to physical or emotional stresses. So whenever we get either physical stress, tired of a whole day's work, or an emotional stress, okay, before exam. So all this is because of the amygdala. Coming to the effect of lesions, the lesion of the limbic system can cause voracious appetite. Remember, indiscriminative feeding. So you eat whatever is there. Okay, so you don't know what is there. It need not be food. It can be any object. They will start eating. So that is indiscriminative feeding. Voracious appetite. You can't stop it. You feel hungry. You keep feeling hungry all the time. I know many of you have that normally itself. Next, increased perverse sexual activity. So your sexual activity is more, and it is more of a pervert in nature. So it is not very appropriate. Increased sexual activity. Next, Docility, loss of normal fear or anger response. So normally when someone comes and slaps at you, you get tensed, you try to hit back. But what happens when there is some lesion in the amygdala or the limbic system? Docility. They lack this loss of anger. They don't respond. They become very calm, very docile, very subtle. Yes, ரொம்ப நல்லவங்களா ஆயிடுவாங்க. அவன் ரொம்ப நல்லவன்பா. Yes. Next is your memory loss. Damage to hippocampus portion. So we just now saw the Pathway circuit. Hippocampus plays an important role. So when there is a damage to the hippocampus, there occurs memory loss. Yes. Who am I? Yes, yaru. So they have some memory loss as well. Other applied aspects, there is this psychosomatic disease. There is continuous activation of limbic system during mental stress, like essential hypertension, gastric ulcers, chronic diarrhea. So whatever the brain thinks gets stressed, the body expresses it, right? So that is your psychosomatic disease. Next is your Korsakoff's psychosis. Can you see here? This is the first hemorrhage into the mammillary body. Whereas the second slide here, you can see the atrophy of the mammillary body. So complete atrophy occurs on worsening of the condition. So what is this Korsakoff's psychosis? This is it's due to, mainly it is because of nutritional deficiency caused by alcoholism. Lesions were found in mammillary bodies and some limbic structures also. So the subject suffers from some amount of confusion and memory loss. Finally, the Kluver-Bucy syndrome. We saw it in the previous class that it's because of lesions of temporal lobe, but there is damage to certain limbic structures as well that precipitates to Kluver-Bucy syndrome, where the individual has visual agnosia, increased oral tendency, decreased emotional reaction, hypersexuality, and hypermetamorphosis. So whenever we have any problem, yes, so our Talevar Vadivel is the best example. That's the reason I put a lot of memes. Emotions now, Vadivel now, who else? So we have to keep calm and say, aha, yes. Okay, thank you. Thanks a lot. Have a nice day.